Start by cleaning your hands with soap and water or alcohol-based hand gel. Clean your work surface with soap and water or a disinfecting wipe. Gather the equipment and supplies you need: a vest machine, a correctly sized vest or chest wrap, connecting tubing, padding if your patient has a feeding tube, non-sterile gloves, a suction machine with its supplies if your patient uses one, and a nebulizer machine with its supplies if your patient receives nebulized medication during vest therapy. Put on the non-sterile gloves. Place the vest or chest wrap around the patient's chest. It should be worn over a thin shirt and should fit loosely around the chest, completely covering the rib cage. Make sure the top of the vest doesn't cut into the armpit area. The bottom of the vest should be just above the hip bones. If the patient has a feeding tube, use padding under the vest to protect the site. If the patient uses a suction machine or neb machine, check to make sure it is functioning properly. Check that the frequency and pressure settings on the vest machine match those prescribed by the healthcare provider. For each piece of tubing, connect one end to the vest and the other end to the vest machine. Turn on the vest machine. Coach the patient to breathe normally and to take an extra deep breath about once each minute. If using nebulized medication during vest therapy, give it to the patient now. Always give the medications in the order prescribed by the healthcare provider. Monitor the patient's color and comfort level during therapy. You may stop the session if the patient has pain or needs to cough. Continue therapy for about 5 minutes, with the patient breathing normally but taking an extra deep breath every minute. Then take a 30-second to 1-minute break. During this time, encourage the patient to cough or huff cough. If included in the patient's care plan, use suction to help remove secretions. When the patient finishes coughing up secretions, repeat the cycle of 5 minutes breathing, followed by resting and coughing for the prescribed number of times. A therapy session typically lasts about 30 minutes. Sometimes, settings on the vest machine are adjusted between cycles of 5 minutes breathing, followed by resting and coughing. Check the patient's care plan to see if it prescribes changing settings between cycles. When the therapy session is complete, turn off the vest machine. Remove the vest or chest wrap. Encourage the patient to cough or huff cough. Use suction to help remove secretions if necessary. Remove the non-sterile gloves and clean your hands.